This is LiveWell Talk on a day in the life of dining services team member. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Today's episode is part of a series on the podcast where we sit down with various team members of the hospital. And today we're going to meet Hope Clark, Director of Dining Services at St. Luke's, to discuss the types of roles that make up the dining services, as well as what goes on in the dining service on any given day. During the pandemic, we learned that medicine is a team sport, and there's more than just doctors and nurses that work at hospitals. Today we're going to find out some of the trade secrets of the dining industry and services and how they make that happen. Hope, welcome.
Thanks for having me.
Yeah, I've said this before. I said it too right before we started the podcast. There's the two hardest jobs in the hospital are the house supervisor and Hope Clark is the second one. Because as director of dining services, so many factors influence your day that I don't think people have any concept of that. Just kind of take us through, what's your normal day?
Well, it's just a little bit of everything. It seems like we have dietitians in our department that's up on the units, checking nutrition of the health of our patients, making sure they're on the right diet plans, whether it's low sodium, carb control, you name it, they monitor all of those intakes. Then we have our call center team who are, taking orders and making sure those patients are following the nutritional guidelines that the dietitians and the doctors have, set for those patients. And then that moves right into the tray line team. They, get the tickets in the back. They prepare those trays. We have tray passers who are actually delivering the food to the units, making sure that we are delivering the right food to the right patient. And then, those trays come back down. Well, somebody has to clean them. So then we have a dish room crew. We have the cooks who have to be knowledgeable on diets as well, whether it's the, dysphagia diet or, they're watching the sodium intakes or questioning some of the meals that the call center approved, making sure that those trays are right for that patient. Our supervisor team does a great job, kind of keeping everybody in line, keeping the flow going. Then, there's the cooks who are doing prep for, maybe the next day or continued on for whether it's the tray line, the cafeteria, catering, you name it. They're kind of all, just a big team putting it together. The caterer does, they stock doctors' lounges to make sure the doctors get fed when they're done with cases. And then they even cater meetings on top of that. We have our cafeteria team who, is stocking the cafeteria and making sure we're ready to feed our employees and feed our visitors. And then just making sure, those visitors feel welcome. Maybe they're having a rough day because, they heard some bad news for a loved one, or, they just want to come down and get away because they've been in a room all night or, and then, you come to our purchaser who has to make sure we have the food in stock. So he's walking around figuring out, what are we short on? What do we need to order more of? It's kind of just a big rotation that we do every single day to make sure, everything's in line. And then, you have your supervisors who's completing the paperwork piece of things and, the management team and the secretary. It's kind of just everybody, compiling into one and making it happen every day.
That's fascinating and truly illustrates the team effort that you have and the diverse team that you have to manage to make things happen. I was probably in elementary school and we had a tour of St. Luke's. And I remember that this is when they still did the laundry here before the Iowa health system, so this is back in late 70s. And they said that the hospital did more laundry in one day than a mom would do in her lifetime, And so kind of along that line, how many meals do you get out on any given weekday?
We average anywhere about 500 a day, give or take,
Wow.
Just depending on the season. This time of year, we're so much busier that we are than maybe in the summertime. But yeah, right now we're just running all day long. And, I have team members who wear, a watch to track their steps, and they easily do 15,000 to $20,000 or 20,000 steps a day, to make it happen and feed those patients and, maybe get down to the ED and make sure those patients' needs are being met along with those staff who don't have time to come down and get fed as well.
Yeah.
So,
wow.
Yeah.
And what is the window like lunch? When you how much time do you have to get those meals out?
So we promise the patient 45 minutes or less from the time they order to the time they receive their tray. Some days are more challenging than others to make those happen. For example, if you have a dysphagia diet that is a parade meal, those meals take a little bit longer to get prepared than what a normal meal would.
And just for the listeners, that is a diet where the food's consistency is changed, so it's easier to swallow, less chance of the patient aspirating or choking on the food. Yeah. I got to be honest, it never looks very pleasing when you see it, but
some of them smell better than what they are. Some of them we don't have a choice for. We buy, a frozen product and, we cook that off. But, there are some items from our menu that, we mince ourselves or we puree that ourselves to make it a little bit better. I've test trayed a couple of them. They do taste well. I mean, it's just kind of the chewed up version of what you normally would get. So,
you mentioned products, supply chain. I mean, the pandemic and the great resignation and et cetera, et cetera. How's the supply chain in your department?
It's still a battle. Pandemic was worse than it is now, but we kind of just take what we can get some days. There's product that have been out of stock for the last 2 years. Production teams trying to make it happen again because they're short-staffed like, everybody else, it seems like. So they're trying to get processes and, their manufacturers back in place. We struggle now with, the quality of some of the products we get. Like, this time of year especially, produce isn't as great as quality as it would be in the summertime.
Right.
So we struggle with making sure those products come in, good and fresh and, not, spoiled or rotten. Or same with canned products. If something comes in that's, the box is all banged up, dented, we can't open those cans. That could be a huge food safety concern with, maybe it got a little bit of metal in the product because it was beat up, because we don't know what that can went through to end up coming to us like that. So it's just a constant.
And that's just thrown away then?
Well, we monitor it. We let our vendors know so we can at least get a credit back for it.
Okay.
And then they report that to the manufacturer saying, we're getting a lot of damaged products in, so that's something they kind of just keep an eye on.
Yeah, it is fascinating how many steps are involved in just something that is just a person walking around you take for granted,
Yeah.
Like we expect fresh grapes in February when it's out of the growing season,
right?
But we're so used to that, and I can remember, like, you can still see watermelon like in the winter, and tomatoes, and I can remember being a kid where, like, you just didn't have tomatoes in the winter, right? Unless they were canned or something like that. But we've been spoiled, haven't we? Yeah. What's the biggest challenge of your job?
Staffing. We still struggle with keeping a full staff. We have multiple call-ins every day that's, out of our control, whether it's, my kid's sick or, that employee's sick or, just having trouble getting to work or car issues or, you name it. We've probably heard it all when it comes to staffing. But yeah, it's every day. It's very rare. We don't have a call-in during the day, but, when we do, it's kind of a, we're kind of waiting for the calm before the storm to see, maybe, somebody calls in the evening. We might be full staff during the day, but then when our second shift comes in, maybe one of those kids have homework that they need to get done. So, of course, that takes a priority over, the job at that point because, of course, their education comes first.
Right.
So,
what was your degree that you got into this line of business?
Well, I went to Kirkwood through the culinary program there. I was one of those 18-year-olds, didn't really know what to do with my life. And, my family likes to cook and learned a lot of it from my mom and my grandma. And so I was like, why not go to culinary school? So, did the 2-year program there. I ended up with, the competing hospital as a cook there, fresh out of college. And, when I started there, I was like, I'll give it, a few months. Here I am 15 years later, still in healthcare food service. I just enjoyed it so much. So yeah, I had no idea where I'd ended up, but I'm glad I chose, where I did first start after I graduated.
Well, I mean, you have the gift of being one of those people that brings out the best in other people. That's so obvious to see. So that's we're lucky to have you from that standpoint. But let's go back to the opportunities that a young person could have in dining services. You mentioned culinary school from Kirkwood, which has over the years built quite a reputation as being a high value degree from Kirkwood, the hotel and everything else out there. But what are some opportunities for first line employees or to join the team, and where can this career take them?
Really anywhere. A lot of our kids, whether they want to go to nursing, dining is a great way to start, because then you understand the nutritional components when you do become a nurse. And when you start taking your classes, you'll realize there are nutritional classes that you might have to take, and then you get familiar with the diet. So it just makes you one step ahead of the game. I've had team members go to phlebotomy or, radiology. Really, you can go anywhere. Our dietitians are the only ones that require an education.
Right.
And, those dietetic programs are everywhere. Iowa State being the most popular one, in the state of Iowa here. But yeah, I mean, there's all kinds of opportunities. Like myself, I started as a cook, became a retail manager, worked for clinics doing patient satisfaction and provider retention for a while. And then I came back and worked patient services side in dining for a few years, and now I'm up to a director role. So, I mean, you can move pretty much anywhere within healthcare, and then healthcare gives you those great opportunities to do that.
Yeah, I had never thought of that. But it does give you an opportunity to get in the door and see what direction you want to go in healthcare. I mean, you can see, like you mentioned, phlebotomy, radiology. I think they can get no pun intended, since we're talking about food, a taste of what opportunities are in healthcare. My dad said, go in either to medicine or food, because people will get sick and people have to eat. Yep. So it's kind of the best of two industries that come together with you. Well, Hope, I started this podcast by describing your job as the number 2 hardest, and I'm going to make my house supervisor friends mad at me, because I've come to the conclusion after talking to you that your job is the hardest in the hospital, and they're now number 2. And so we may get some hate mail, but that's okay.
Bring it on.
Hope, thank you for joining me today and sharing about a day in the life of dining services team members. Once again, this was Hope Clark, Director of Dining Services for St. Luke's Hospital. If you're interested in a career in dining services at St. Luke's, visit unionpoint.org/careers. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.